Have you ever brushed your teeth and noticed blood in the sink? Maybe you just ignored it because it doesn't happen every day, or maybe somebody told you it's normal. No, it's not normal. Healthy gums do not bleed. Today's video, I will explain the 7 common reasons why your gums bleed, what they could mean, and what you should do before the problem becomes painful and expensive to treat. Stay until number 6, because it's something that surprises many people, especially women. Hi, I'm Dr. Nduka Chidinma. I'm a dentist. I am also an oral health educator and AI and automation specialist. On this channel, what I do is I simplify dentistry. I help you prevent dental problems before they become expensive. And I occasionally show you how AI is transforming healthcare. If you're new here, hi. I want you to consider subscribing because every week I share practical dental tips and expert advice that saves you time, pain, and money. So now, the number one reason why your gums bleed is plaque buildup. Okay, you might want to ask me that. What is plaque? Plaque basically is a sticky layer of bacteria. Okay, that forms on your teeth every single day when you don't brush properly, or maybe you don't floss regularly. This bacteria sits around the gums. Okay, and your body reacts by causing inflammation. Now, those inflamed gums, they become swollen, red and tender, and then they bleed when you brush. For instance, now, think of maybe dirt under your fingernails. If you leave it there long enough, you notice that the surrounding skin becomes irritated. That's exactly what happens to your gums. But now the good news is that this stage can be reversed, okay? But you might want to ask me that what happens when you leave the plaque for so long, okay? That is what gives rise to cause number 2, gingivitis, okay? And the next cause surprises many people because they usually are trying to make their teeth clean, but they're doing it in the wrong way. And that is brushing your teeth too hard. Believe it or not, scrubbing your teeth harder doesn't make them cleaner. It actually damages your gums. Most people, when they want to brush, they're literally battling in the, in the bathroom. So first of all, you want to use a soft brush, okay, and fluoridated paste. So a paste that contains fluoride. And don't do this like you're scrubbing. No, you don't scrub. You use a soft brush and you move in a gentle circular motion. So this way, gentle circular motion. Okay? Okay. The same thing. I don't know if you can see me. Gentle circular motion, gentle circular motion, gentle circular motion, gentle circular motion. Okay? So I have a video where I showed how to brush. I hope you saw this. So now remember, the teeth has different surfaces. It has this outside, it has the inside, that is here, here, this inside as well. And it also has this outer surface. The same thing with the lower teeth as well. It has this outer one, it has the inner one, and it has this surface. And also don't forget your tongue. Okay? Even if you brush twice a day, you could still be missing almost half of your tooth surface. Why? Because you're not flossing. Now, your toothbrush alone, right, cleans about 60% of your teeth surface. But now, the remaining surfaces of the teeth, because this toothbrush cannot get in between the teeth, right? So that's why we need to floss. So it's either this is a floss, this is interdental brush. I'll show you how it looks like. So you either get a floss, this is how it looks like, or you get an interdental brush. Okay, they're different, makes different products, but this is what you use interdentally in between your teeth. Okay, so you can imagine if you don't floss, the whole bacteria that's in between your teeth stays there and then causes more harm. So now this next cause isn't as common, but when it happens, it doesn't just affect just the mouth, it can affect the whole body. Okay, and it has to do with vitamin deficiency, most especially vitamin C, and then less commonly vitamin K, and then we also have poor nutrition. Okay, so first of all, let's start with vitamin C. So vitamin C is essential in producing collagen. You might want to ask me, what is this big grammar, collagen? Basically, collagen is just a protein, okay, that keeps the gum strong, healthy, and then firmly attached, okay, around your teeth. And you can imagine when your body doesn't get enough vitamin C, your gums, they become weaker, more fragile. It becomes inflamed easily, and then you can start bleeding. Okay, you can start bleeding even when you brush gently or maybe eat some certain food. Okay, But now there are some severe cases where you can have prolonged vitamin C deficiency. That condition is called scurvy. Okay, and that's where bleeding gum is one of the classic signs. Okay, so now let's move to vitamin K because I'm already teaching you guys so much. Let's move to vitamin K. Vitamin K plays a different role basically. Okay, it helps your blood clot properly, and if you are deficient in vitamin K, which is less common, okay, your blood may not clot as efficiently. Okay, so even minor irritations to your gums can result in prolonged bleeding. And then let's go to the last one, where you have poor overall nutrition. Okay, this can also weaken your immune system, making it harder for your body to fight bacteria that can cause gum irritation. This means that your gums are likely, okay, to be swollen, infected, and then they bleed. But now the good news is that many cases can be prevented by eating a balanced diet. Okay, like food rich in fruits, vegetables. Like example, you have oranges, guava, um, strawberries. These ones are excellent sources of vitamin C. Then for your leafy green vegetables, those are excellent sources of vitamin K. All right. However, it is important to note that not every case of bleeding gums is caused by a vitamin deficiency. In fact, the most common cause of bleeding gums is plaque buildup and gum disease. That's why if your gums continue to bleed, despite you improving your diet and then your brushing habits, you need to see a dentist for a proper examination. Okay. Have you ever heard a pregnant woman say that since I became pregnant, my gums have been bleeding when I brush? Believe it or not, this is actually quite common because here's what's happening, right? I'll break it down for you. So during pregnancy, your body produces, much more higher level of hormones like your estrogen, your progesterone, right? So these hormones basically they increase blood supply to your gums and make the gums more sensitive. Hmm? At the same time, this hormonal changes also makes your body's inflammatory response stronger. In other words, your gums react more aggressively to the bacteria in that plaque. Hmm? So now think of it this way. Before pregnancy, a small amount of plaque might not have, caused much irritation. But during pregnancy, that same amount of plaque can trigger a much bigger inflammatory response. Your gums can become swollen, red, tender. Why? Because your body's immune system is reacting to that bacteria around your teeth. And when your gums are swollen, inflamed, those tiny blood vessels inside them become more fragile. Okay. So all this English I'm explaining, right? We the dentists call it pregnancy gingivitis, and is most common in second and third trimester. I don't know if this mic is working, but oh well. So here's something many people don't know. Pregnancy itself doesn't directly cause bleeding gums, right? Instead, pregnancy hormones make your gums much more sensitive to plaque. So if plaque is present, right, the inflammation and bleeding becomes worse. The same thing happens during puberty, menstruation, menopause, During these stages, this, changing hormone levels can cause the gum more reactive to the plaque and increase the risk of swelling, tenderness, bleeding. But now, the thing is, you don't have to accept bleeding gums as normal. Now, we've reached the one you really do not want to ignore, which is periodontitis. And periodontitis simply means advanced gum disease. Okay, remember when we spoke about gingivitis? Gingivitis basically is the early stage of gum disease. Hmm? It just means inflammation of the gums. But now, when that gingivitis is not treated, if it is left for a very long time, it progresses to periodontitis. Hmm? Remember, I told you that gingivitis is just that you have plaque around the gum lines, right? Those plaque doesn't just sit down there. With time, it goes into the gums, right? And as it's doing that, it's creating what we call a periodontal pocket, right? So it's entering inside the system and causing more harm. So now the body actually tries to fight this as well. But unfortunately, while it is fighting it, the immune response also damages the tissues that support your teeth. So think of it like a house with a weak foundation. The walls might still, look fine at first. But if the foundation keeps crumbling, the entire house becomes unstable. The same thing happens in the mouth. The infection gradually destroys the gum tissue and the bone that holds the teeth firmly in place. So I hope we are all on the same page. I hope you're following me so far. Okay, so now the next thing you might want to ask me is what should you do if your gums bleed? First of all, you need to get a soft brush, brush twice daily with a toothpaste that contains fluoride, okay? And you need to floss at least once daily. Eat a healthy diet, and most importantly, you need to see your dentist. One of the biggest mistakes people make is waiting until the gums become painful. Gum disease often progresses silently, which is why regular dental checkups are important. By the way, if you're enjoying this video, I have written a simple ebook that explains the everyday dental mistakes many Nigerians make and how to avoid them. I'll leave the link in the description. Another thing you might want to ask is why S&P matters. If your gums bleed because of plaque and calculus accumulation, brushing alone cannot remove it. Hmm? That's where a professional dental cleaning, that is scaling and polishing, comes in. Now, many people think that scaling and polishing weakens the teeth, but that is a myth. Okay, the scaling, is called scaling and polishing. Now, the scaling removes the plaque and calculus, then the polishing smoothens the teeth. And of course, it has benefit because you have healthier gums, fresher breath, reduce to no bleeding, and you have better smile, right? Before you leave, let me ask you something. Have your gums ever bled while brushing? Tell me in the comment section. I read as many comments as I can, and I did genuinely love to hear your experience. So if today's video helped you, please give it a thumbs up. It really helps, this channel reach more people who need reliable dental information. Okay. And if you're serious about protecting um, your smile, I've written an easy I've written an easy to read, ebook that explains everyday dental mistakes most people make and importantly how to avoid them. You can get your copy using the link in the description below. Also, if it has been more than 6 months since you last had your professional dental cleaning, I need you to consider booking a skin and polishing appointment. Preventive care is always simpler, less expensive, more comfortable than treating advanced dental disease. Finally, if you're not subscribed yet, this is a perfect time to join our community. Every week, I share practical dental advice that can help keep your smile healthy, avoid costly treatment, and smile with confidence. Thank you so much for watching. Remember, healthy gums do not bleed. Your smile is one of the first things people notice. Take good care of it, and I'll see you in the next video.